So next, we will talk about the triangle study, which was recently presented at our annual meeting in December of 2022. So this study looked to evaluate to see whether autologous stem cell transplantation was actually needed in patients, or if we could take that away with the addition of an oral medication, again, Ibrutinib, which we discussed earlier in the SHINE study. So in this study, it was a bit different. So there's a 3-arm randomization. You got randomized to either a regimen of intensive chemotherapy, followed by autologous stem cell transplantation or observation, which was subsequently amended to allow for rituximab maintenance after the previous study we discussed was reported. Or you got the first experimental arm, which was intensive chemotherapy plus Ibrutinib for only the R-CHOP-like cycles of autologous stem cell transplantation, and then you will receive 2 years of Ibrutinib as a maintenance treatment. Again, that was subsequently amended to also include rituximab maintenance after the previous study was reported out. And then the third arm, again, you still had R-CHOP, which is in this part of the experimental intensive treatment arm, plus Ibrutinib, which is that oral BTK inhibitor. And instead of getting into an autologous stem cell transplantation, these patients will subsequently just transition to 2 years of Ibrutinib maintenance, meaning you took that medication every day for 2 years. And again, it was subsequently amended to allow for maintenance rituximab together with the Ibrutinib. So again, 3 arms, one with just standard treatment, one with just the experimental arm, adding Ibrutinib, still with the addition of autologous stem cell transplantation, and then 2 years of maintenance Ibrutinib. And then the third arm, which again, intensive chemotherapy plus Ibrutinib, but eliminates the autologous stem cell transplantation altogether, and then subsequently continues with 2 years of Ibrutinib maintenance. So again, this was a very large trial conducted in Germany, which was the first trial of this nature to sort of evaluate the benefit of Ibrutinib maintenance with or without autologous stem cell transplantation. So if we can look at the information provided, what you can see from the box here on the right, it is very important to see that the failure-free survival, which is akin to a progression-free survival, meaning your time while the treatment is working, keep the cancer in remission. As you see, the experimental arm that includes Ibrutinib was in better than what we see with the standard of care arm, as we see a very early separation in the curves, thus supporting the benefit of the experimental arm in this patient population. So ideally in this situation, which is not shown here, but important for you to know, both experimental arms were equivalent. So A plus I without transplant and A plus I with transplant, both were equivalent and both seem to be better than a treatment with transplant alone. So the things that we didn't discuss, and which is something you'll need to discuss with your clinician, if this is a regimen they plan to implement for you, is the benefit and who are the patients who truly benefited from this regimen, and whether you meet the patient characteristics of those who can potentially avoid autologous stem cell transplantation. But for majority of us, what this is probably an early suggestion that we can probably eliminate autologous stem cell transplantation for most of our patients with mantle cell lymphoma, which will be a big benefit in some situations just because of the toxicity that can come along with an autologous stem cell transplantation. But I will caution that this study is still very early, meaning that the follow-up has only been about 3 years, and typically we would like to see follow-up at least another 24 months to determine if autologous stem cell transplantation is something we can remove out from our patient population, or if we would keep that together with the oral medication Ibrutinib. So very exciting study, very exciting times, very encouraging early data, and we all cautiously and anxiously await for more follow-up of this study as it matures.